can we afford all these promises? Prof, you did some maths to say if potentially, I think at the bare minimum, we needed extra 200 billion rand to get this going. What will be the impact on taxes? Do you want to just share some of that math?
Yeah, well, just to clarify, I mean, the 200 billion is not a number that we have calculated because we haven't. I mean, since the green paper, we haven't seen any numbers in terms of, and nor do we know what the benefit package or service package is likely to look like for NHI, and that's what's required. I mean, back in 2009, I think it was. I was involved in setting up the NHI task team of the Actuarial Society to build a model to look at the scenarios, because, I mean, that's what the World Health Organization says about health reform. We should be building scenarios, we should be understanding what we can do, and we should be incrementally seeking to achieve that. So the 200 billion number actually comes from the NDOH, the Department of Health's calculations, and it's basically based.
So Percy calculated.
But I'll tell you where it comes from, though. It comes from this notion that you can substitute medical scheme contributions for tax.
I see.
You know, that those people who are paying medical scheme contributions would be willing to pay that as a tax. That it all goes into one big pot. And that everybody is better off. And it would be great if that was the case. But unfortunately, it's not, right? Because what happens is with a very narrow tax base, because, I mean, bear in mind, I mean, we have a narrow tax base.
Also, you can share the numbers.
It's about 75% of the public health financing that's actually coming from the very same people who are also paying largely for themselves. I mean, as you say, I mean, there's still out-of-pocket expenditure. And so we have to be really careful in how we manage the risk of having a narrow tax base. And raising to another 200 billion from that tax base is really, you know, as the economists calculate it, it's not feasible. And certainly not all in one go. We need to be demonstrating value, which is, you know, what National Treasury has been suggesting. So it needs to be this kind of incremental approach. And I think, again, you know, we're aligned. Primary healthcare is the place for us to start investing in preventive and promotive care, broadening that access, alleviating the pressure on our tertiary and secondary and tertiary institutions, which are often inappropriately being used for primary primary care, and making a difference to population health, which then drives economic growth. And I think that needs to be done in a partnership model rather than as a single fund model. I mean, the challenge we've got, I mean,
partnership will mean not just one big fund, but have the medical schemes coexist.
Yes, and leverage funding sources from those who are willing to pay, right? So, which has always been a principle of our health policy, and that's how we crowd in funding. Because the notion of raising taxes, I'm sure this audience is aware. You know, you always have that. You know, you can't just say, well, I'm going to increase VAT by 7.5 percentage points and expect that your coffers are going to increase by 200 billion. And National Treasury has been clear as well. We've got multiple social needs. I mean, Dr. Mahlati has mentioned the social grants, and I mean, we really need to look at how we can leverage funding to make sure we're lifting more families above the poverty line. So we need this kind of more holistic and cohesive view. And it's so important that we don't take the hands-off view and say, oh, it's too expensive, we can't afford it, let's do nothing and keep the status quo.
Lovely.
There is so much we can do between, the extremes. And it does require this incremental approach.
Sure. I saw a number that, for instance, if we were to touch VAT, we may have to increase VAT from 15% to
21.5%, yeah.
Anyone can afford that here?
Yeah.
And if it's not VAT, there were other two scenarios.
So what the Act mentions, so the NHI Act talks about personal income tax.
Yeah.
So raising personal income tax 200 billion from personal income tax, we would need to increase it by about 30%. So that's the tax
so what
you
we're currently
pay.
paying,
You'll
pay a third more.
Yeah.
Right. So, Percy, how do we get to this?
Well, maybe we'll cycle back to the issue that Nkulu was challenging, because you see, policy, you don't carry a guillotine when you change policy. You actually become incremental, and you actually look at the loopholes and all that. But let me come to the issue of, look, there is a lot of debate internally, even within the department, inside government, including Treasury.
Yes.
I'm sure many people would know that even from the public pronouncement by our, I'm not sure whether to say former minister or minister, because, was that it's going to take some time.
Yeah.
Because there are so many things that have to be in place.
Sure.
One that I understand is very critical is what they call a money bill.
Yes.
Which must come from Treasury. It's not yet up there. There are other issues that would have to have a political discussion on. For instance, where do we get the funds? One of the ideas is that the transfers to the provinces, equitable share would actually, but that has got major implications because
they don't fund Nkuli's overtime.
No, that overtime is simpler than the fears that have actually been put out there. I will explain it later if there is time. But I think the issue is, how do we pull in, where the resources that we have to fund, the services. But I think one step which I was alluding to earlier on, if we've not agreed as to how we structure our health system, then we're going to get it wrong, because then we'll be pulling in money to fund a very fragmented system. That is actually where the start, should be. That is why you are engaging. Fine, some of us are not engaging in public, but we're engaging on these sides to actually say, look, how do we make sure that our health system becomes resilient? If you don't have health professionals, not only doctors, if you don't have health professionals, in the number that is required, you won't run a health system.
Of course.
You may have 100,000 doctors, but if you don't have nurses, physios, they will not run your system. Same time, the opposite of that, if you don't have doctors and all the other, professions, you won't have a health system. So we've got to balance and then say, how do we fund the kind of resources that we pull together will not be financial only. You need infrastructure, you need human capacity, you need equipment, and all those kinds of things. So I think that is actually the conversation that with the high temperatures we've had around Section 33, we've forgotten that, look, the major challenge we have is the way our health system is structured.